Toby, good to have you here with us on TRT World. Tell me, what is your organization's assessment of this deal?
Well, I mean, children desperately need some respite from the horrors that they've been living through for 6 weeks now. So that's much needed. Secondly, the Israeli children who are abducted need to be released, and we sincerely hope that will happen. And at the same time, we urgently need to scale up the amount of life-saving aid that we can bring in: water, medicines, hygiene kits, and other aid to alleviate any potential further catastrophe with children living in horrific conditions in shelters and in other areas inside the Gaza Strip without access to basic services. So this is critical elements, and we hope that we can do that. A pause will not necessarily make the conditions always. It will still be tough. The infrastructure is heavily damaged. Moving around, particularly in the northern part of the Gaza Strip, will still be difficult. But we'll do whatever we can to move that life-saving aid around as quickly as possible.
Right, Toby, and certainly we're not sure whether or not that truce is in place, because just seeing the live pictures that were on our screens a few moments ago, we can see an Israeli airstrike hit Gaza. So it is still unclear whether or not the truce has come into place. According to reports, if it comes into place, it will be 4 days long. And during that time period, Israel will allow the entry of humanitarian aid into Gaza. Are 4 days enough for that, Toby?
No, I mean, UNICEF and UN and many others have been calling for a humanitarian ceasefire throughout. That means a sustained ceasefire to alleviate the suffering, to stop the killing and injuring of children, and we continue to do that. If we have this pause, if it happens, then we will be doing whatever we can as quickly as we can to coordinate and bring the life-saving aid to the shelters where we have 1.7 million people displaced, around 800,000 children living in these very densely packed shelters. Waterborne diseases are a major risk now when you have only 3 liters per day per person maximum of safe water. And you have the winter, of course, the rains coming, and a child healthcare system that is on the brink of collapse. So there's a critical elements that we need to work on, urgently. But we need ultimately a humanitarian ceasefire that lasts.
Toby, we have been seeing the distressing pictures of children in Gaza for over a month now. Your organization is actively working on alleviating the pain and sufferings of these children. Help us understand the plight of the children of Gaza right now.
Yeah, I mean, the plight is horrific. What these children are living through day in, day out. There's no respite at all. First of all, we've seen more than 5,500 children reportedly killed, many thousands injured, others missing, others lost parents, lost family members, and this is like a horror. And those who are managing to stay safer are traumatized by being exposed to such levels of violence. And that has an immediate impact, but it also has long-term impacts. So in the media, we've had reports of children from staff members even who are resorting to self-harm because they're in such distress. But we also know that in the long term, this trauma really affects people both physically and mentally for many, many years, which is why we'll do whatever we can to provide the psychological support, the mental health support for children who have been impacted by the last 6 weeks of horror.
Toby, as UNICEF, what would be your message to the international community?
Well, the message, and it has been throughout, is that we need an immediate humanitarian ceasefire. We need children to be better protected. We need civilians to be protected. We need the children who were abducted from Israel to be released. And we need to provide life-saving aid at scale, meaning much, much more. There was already before this crisis, we needed to bring in a lot of aid to support the population inside the Gaza Strip. We needed the fuel at scale. We needed water, sanitation services. And those are our calls, and they have been throughout, and we'll keep pushing for that.
Now, I'm not sure whether or not you already have an estimate for this, but roughly how long would it take for Gaza to basically recover from the devastation that has been caused in the past 46 days?
Yeah, I mean, it's a very good question, and it's very hard to put a number on that. But I mean, let's look at the education system, for example. More than 80% of educational infrastructure has been damaged. Children haven't been going to school for 6 weeks now. Just the education side of things needs a massive rebuild to get it going again. In conflict zones, in many places, we always say, keep the schools open. Let's do whatever we can to keep schools safe and keep children going to school. because it provides some normality even amidst the horror. But inside the Gaza Strip, that's been impossible, of course. So the rebuild is huge, and the water network, the water infrastructure. We know that probably around more than 50% has been damaged as well. So this is all big infrastructural work, but also the physical and mental toll is the hardest one to rebuild for people. And in some cases, we can't because so many civilians, so many children have been killed.
Indeed, Toby, before I let you go, it seems to me that one of the biggest challenges that authorities on the ground in Gaza are going to face is repairing the healthcare infrastructure, because over the past months or so, there have been multiple reports of healthcare facilities coming under Israeli airstrikes. So what do you think future holds for the healthcare system of Gaza?
Yeah, that's right. I mean, we've seen now 2 out of 3 hospitals are not operational, either because they've been damaged or there's a lack of fuel as well. You've seen doctors and medical staff working around the clock to do whatever they can to treat injured children, to treat injured civilians. And the toll on the medical staff is horrific as well. So the whole medical infrastructure needs to be rebuilt. The whole medical staff have been going through trauma themselves. So there's a huge amount of work that needs to be done. And we keep bringing in medical supplies. We're trying to bring in more as well to at least bolster a little bit the resources for hospitals and the fuel to make sure the hospitals can even function because they need the fuel. So we're trying to alleviate that as much as we can. And the pause will hopefully help to scale that up. But the impact on the health services more broadly has been catastrophic.
Toby Fricker, fascinating insights into the topic. Thank you very much for joining us here on TRT World. Really appreciate your taking out the time.